Late last year, Massachusetts voters approved a measure that would allow for the legal distribution of medicinal marijuana within the state. The issue has prompted discussion about regulating the dispensing of the drug in various cities around the state, including here in Attleboro. Ward 2 City Councilor Mark Cooper has been preparing to discuss the issue with the Attleboro City Council. We spoke with him about the issues cities are having to tackle in order to promote the safe distribution of the drug.
My name is Mark Cooper. I'm the Ward 2 City Councilor, Chairman of Public Safety and Emergency Management, and two pieces of new business were introduced to the Council to consider medical marijuana. I'm just going to read right from the Mass DPH website information that was sent to all the councilors from the public health nurse, Jackie O'Brien. I just want to read there's very specific details in here. So first of all, the patient must obtain a written certification from a physician for a debilitating medical condition. The law specifies cancer, glaucoma, AIDS, hepatitis C, amyotrophic lateral sclerosis, which is ALS, Crohn's disease, Parkinson's disease, multiple sclerosis, and other conditions as determined in writing by a qualified patient's physician. The law allows qualified patients to possess up to a 60-day supply of marijuana for their personal medical use. The law directs DPH to define a 60-day supply through regulation. As you know, I'm a registered nurse, and I have most of my experiences in critical care medicine, and I haven't had patients that have used medical marijuana for the purposes described here, but I have had patients that have used the oral form of a synthetic substance that is for appetite, to induce appetite. And it seems to have worked for those patients that had failure to thrive, particularly post-transplant patients that had failure to thrive, just didn't feel like eating. We would give them that, and that would induce some appetite. The city, in terms of business zoning, is broken into three areas: central business, general business, and planned highway business. And it's these areas that I think we ought to focus our regulation on allowing or not allowing in the city. You know, there may be some revenue generating opportunity in and through this process, but the goal of passing this wasn't to make money per se. It was to help people with those listed medical conditions. I do think that from it will spur other business if we have these distribution centers in Attleboro. There is a limit to the number of distribution centers. The law allows the Department of Public Health to register up to 35 nonprofit treatment centers across the state with at least one but no more than 5 centers per county. So that also puts a bit of a filter on how many each community could have. Those are the important issues that I think the council needs to consider at this point, given the fact that the Department of Public Health has until May 1st to issue some regulation around how medical marijuana will be allowed across the state. So February 12th, we will be discussing in the Public Safety Committee meeting. I've asked all the councilors to send to me send to Linda Alger any information that they have, any thoughts that they have about this issue, so that on Tuesday we can have an intelligent conversation and debate about how we think this should move forward. One of the sites that's very useful is mass.gov, and then you would click on the Department of Public Health, and there's a lot of information, good information, and these frequently asked questions that I've referenced here talking with you today are also listed on there, and it's a good point of reference for people to look at. That site's very good, and I would caution people not to just randomly Google, you know, medical marijuana and focus on the science of what the medical marijuana is all about. There has been no date for our public hearing process, which has to happen in order to change the ordinance. And there's a pretty lengthy process that we'll have to go through. And ultimately we need, I will continue to argue that the City of Attleboro needs to wait until the regulations come from the Department of Public Health before enacting any new ordinance relative to medical marijuana. So they say they're supposed to be ready May 1st. We'll see what happens after that. But I think what's important for the City of Attleboro to do before then is to talk this through as a council so that we know where we stand, perhaps put a draft ordinance together with input from the police department, fire department, public health, new health agent, and put something together, discuss it in the committee, and then send it with the regulations to the city solicitor to make sure that they both mesh, have the public hearing, and vote the ordinance.